Good evening, Malden, and we're back with another COVID update. My name's Gary Christenson, Mayor of the City of Malden, and I'm alongside, you know who, our community partner, Urban Media Arts, formerly known as MATV. Today is Tuesday, September 14th, and we're going to be with you for the next hour talking about what we know. And I think the theme of this show is that progress is being made. So without further ado, let me introduce our panel. We have Christian Lanfair here from Cambridge Health Alliance, along with the health director of our department, Christopher Webb. And then finally, Scune Carrington from the Board of Health. And then, you know, none of this happens without our communications director, Ron Cochran. So Ron, do you want to tell people how they can contact us during tonight's show?
Sure, thank you. And as always, we like to hear from you on whatever channel you can participate. And that would be by visit us on social media, on our Facebook page, and we're monitoring our messenger tool there. So if you want to private message us your question, we'll also be looking in the thread of the announcement of the show. We usually look there as well. You can make your comments on the YouTube feed itself. So if you are watching us right now from YouTube and you want to ask a question right in there on UMA's channel, we'll look there. And then lastly, if you're sort of more the traditional type and you like to call in, we can do that as well. Folks at UMA are waiting for your phone calls at 781-388-9394, and we'll patch you in live to the panel for your question.
All right, but before we do any of that, let's hear from our panelists this evening. So they will provide you with a brief introduction of who they are and how to contact them in case there is a question that you weren't able to ask or you think of it after the show is over. So with that being said, let's start off with our health director, Mr. Christopher Webb.
Hello, everyone. Great to be back again. I enjoy doing these shows. A lot of good does come from it, believe it or not. We did get great feedback and we do appreciate it. If you have more for me, please call me at 781-397-7049, or you can email me at cwebb@cityofmalden.org.
All right, over to Christian Lanfair.
The show usually.
Good evening. My name is Christian Lanfair. I'm with the Cambridge Health Alliance Health System, and I am looking forward to talking with everyone tonight. Especially, I'm happy how I get to, I get to go into Malden and to many of the coffee shops, and many of the participants do here listen to this show. So, reach out to us at any point. I can be reached at 617-665-1000.
Great, and then finally, Scune Carrington.
Good evening, Malden. I'm Scune Carrington. I'm one of the members of the Board of Health, and thank you for tuning in this evening. And if you do have any specific questions for me outside of this setting, you could reach me at bohresponse@cityofmalden.org. Thank you for tuning in.
All right, very good. I think, Ron, what we'd like to do first is get a lay of the land. So let's hear from each of our panelists on what they're hearing and what they're seeing. Let's start off with Mr. Webb.
Oh, we are in a downward slide like we had thought. I wouldn't say it's slide, but downward tick is a better way to put it. We're down to 1.92% positivity, which is pretty impressive. Anything below 2 right now it's got to make you happy. Some of our neighbors are struggling still, probably harder than it should be, and it really does come down to a couple of things. Testing rates have gone up across the board. I checked some of our cities near us that are having a hard time. I thought that maybe that their testing rates hadn't improved, but they have. So that's scary that their testing rates went up and their positivity went up. What you'd like to see is your testing rates to go up and your positivity go down. Okay. In our case, we had we had 7,444 over the last 2 weeks. The 2 weeks prior to that was somewhere in the 4,500 rate, 4,551, I think it was. So a 2,000 person increase is a good amount in a 2 week period. More would be better because that would drive our number down. But then again, it could drive our number up. The way to avoid all of that, though, obviously, is to get vaccinated. So I would keep pushing people, please get vaccinated. There's really not another option. And now we're starting to see our kids getting sick, and they're going to get the younger ones are going to start getting sicker soon too. And that's very concerning for anybody. It has to be.
Okay. And Chris, just before we move on to Christian, the 1.92% positivity rate is over the last 14 days.
Yes, it is.
Okay, very good. All right, Christian, I know you always talk to us about what you're seeing for hospitalization. So we got together 3 weeks ago. What's happened since?
So I would say that for COVID related hospitalizations, I think they remain the same. However, about 90% of the COVID hospitalizations are the unvaccinated. So I want to reiterate Chris's point that you've got to get vaccinated. We are seeing 9 out of 10 of the patients being hospitalized, whether they're in critical care or they're on regular medicine floors, 90% of them are unvaccinated. So it's important to continue vaccination rates. But I would also say that the health system across the metropolitan Boston area is feeling a bit stressed. And these are not COVID-related infections, but just other general medical issues that are going on. So I think that the health systems are in a precarious position, but I would agree that we have not seen a dramatic increase in COVID cases. I think it remains very similar. For us, it remains about the same.
All right, very good. And Scune, what are you hearing and seeing?
So the Delta variant is deadly, and especially for, if you are vaccinated, the rate of transmission is much lower for you. So I think that's one of the comprehensive strategies, especially now we are entering the fall and also the winter where people are going to be a lot more indoors. So I think besides, if you're not vaccinated, the masking and the physically distancing and avoiding large gathering, I think we need to basically revisit those sort of strategies as we head into the fall and the winter time. And the Delta variant is just deadly. And I think keeping that in mind for those that are unvaccinated, specifically for those that have additional chronic conditions, and it's just deadly. And I think keeping that in mind.
Okay, very good. So before we get into some general questions, Chris, can you let the community know where we are as of tonight, fully vaccinated?
Fully vaccinated, we're at 70%. That hasn't changed. We went up to 70% just a little bit ago. We were at 70% for one vaccination. Now we're at 70% for 2 vaccinations. So that's pretty impressive. And I'm proud to say that I'm from Malden because, although we're all professionals and we're not supposed to be comparing our statistics, we do, where it's the nature of the beast. And I am proud to be the guy that they'll say, where's the guy from Malden? And I'm the first guy to raise my hand. That's me. And I'm proud to say to anybody that asks that Malden's doing their part. We've got great communication. It's improving every day, which is very exciting. And I think we've come through this. It was difficult, but we've come through it. We just haven't finished, and everybody knows it's not how you play, it's how you finish, right? So we gotta get to that finish line. We just aren't quite there yet.
Okay, and what is the statewide average fully vaxxed?
It's also at 70%.
Okay, so we're right there.
Yeah, we're right at the state average, and it speaks a lot to people going back to work and school starting. So that's a good thing. We're going to have our challenges with all of that, but as we vaccinate more and we test more, people will have learned to assimilate to those functions that they have to do every day to get through work successfully without being infected.
All right, so the table's been set. Let's take some questions. Ron, you seen anything on any of your channels? If not, I have a series of questions.
Yep, we can actually start with a question that came in on Facebook, and it's concerning the second dose. And I assume what their question is a second dose vaccine. Do we have one planned? Does it work like it originally did, where you would be scheduling it right away along with the first one, or there are second doses that are kind of given ad hoc to those who never got it. So maybe you could explain second dose vaccinations.
Who do you want to start with, Ron?
We're gonna start with, why don't we start with Director Webb on this one?
Do you mean boosters or second doses?
Booster, right?
My assumption, given when he asked it, meaning that, yeah, that's a safe assumption. Second dose probably means booster, I think, at this point.
Okay. Let me just kind of cover both. If you have only had one vaccination and you need a second, and it's been months and months and months, that's fine. Get the second shot anyway, okay? It's still going to give you a boost in immunity that you don't currently enjoy, okay? And we can work out the what's next so you get the full later on with consulting with a doctor or your own primary care doctor. Secondly, boosters are a bit of a debate right now about whether boosters will be necessary. I'm of the camp that I don't believe they are. I'd really like it if they weren't, not for the fact that it's a ton of extra work, but because it's vaccine hesitancy right now is where it's at, because people don't trust the vaccine or they're hesitant. Though they got their first 2 doses, if you're practicing mask wearing when you should in environments, with multiple people that you don't know, chances are your vaccination is going to hold you in good stead. If the booster shots are required, we already have a plan in place. We will be registering people online based on, it'll be just like it was before. The elderly, the infirm, and the handicapped first responders, teachers, and then by age group like we did the first time. It'll be exactly the same way. The only thing is you won't have to come back and see me a second time.
Okay. Ronnie, does anybody else want to add to that, or should we get to the
I would
next
just say
question?
that what I think is different this time, which I appreciate, which the state had done the first time, but we're keeping the vaccine programs back in the communities. And I think that is, there will not be large mass vaccination centers. There will be, there'll be some regional ones, but people should be able to get them from their local board of health. They'll be able to get it from their provider, their doctor's office, CVS and Walgreens. So I really do, what I appreciate about this plan is that it keeps people local, and people don't have to travel long distances to get this third shot.
Christian, is that a result of lesson learned, or is it something that has been technologically achieved?
I think that one thing that Massachusetts residents should appreciate is that for the better part of probably 20 years, our local boards of health have had emergency dispensing plans. They've had these for years and years and years, and they have been practiced. And I think that this is an opportunity for them to really bring out those plans and showcase them. I think that the mass vaccination programs, I think that I can't speculate on what what the state's reasoning was, but the state has decided and they've reiterated this multiple times, that there will not be mass vaccination centers. People will be able to get them locally in their community, which is where we should have been doing this the first time. So
Okay.
I think this is a huge step forward for all Malden residents, but I also think that it's a benefit for the community.
So let me go to Scune. I know you've been pushing vaccination ever since you've been on this panel. Question came in because some time has passed. How? Where do people today, if they want to get vaccinated, go?
I believe there is a website just within the state where you could find out where you could get the vaccination. Yeah. And then also, again, your primary care doctor, and also the local pharmacies. And yeah, so I think reach out to your doctor, reach out to your local community health providers, and then also call 211 and they'll be able to tell you where you could get vaccines.
Very good. Let's stay with Scune. All the focus has been on COVID. Are you getting your flu shot this year? What's your opinion on that?
100%. Because what I think Christian Lapierre like spoke earlier about like the hospitals are just at a point right now, and I wouldn't want to catch the flu and needing to go to the hospital at any point. So I think just any preventative method that I can take to avoid catching the flu, especially we going back indoors and all of that. So I'm definitely 100% gonna get my flu shot this year.
And Chris and Christian, when will that vaccine be available? When do you anticipate giving people the flu shot? Chris and then Christian?
We're hoping to be starting that in late October, like we normally do. We're just ramping things up. We're kind of waiting to see if this was the year they were going to come up with the COVID/flu. I know that it's been researched and it's waiting approval. So maybe next year.
Okay.
For that one.
Christian, same timeline for you?
Yeah, so, there's been a lot of debate back and forth about when is the most appropriate time, and our infectious disease docs have really, their push is we really should be doing this in October so that we can really get, we can prolong the immunity for flu, because flu runs, flu's been going into March, April, and May. And so we really want to make sure that people have sufficient coverage.
And Christian, will that too be as it has been over the past X number of years, that will be handled locally?
Yeah, and I think the local boards of health, I think, the primary care systems, pharmacies, I think we've done a very good job because we do it every year. And, I think they've done a nice job with flu. So I think people should get their flu shot. And I think they should get their, if the recommendation based on clinical data from the FDA, which is meeting this week, determines that the third dose shots are appropriate for Moderna or Pfizer, then people should really get that third shot so that they can boost their immunity.
All right, very good. Ron, I'm going to go back to you in 1 second. I just want to say with Christian on something because he's talked about it in the past. And this question has come up, Christian. His herd immunity out the window, or can we still achieve it?
I think that, the vaccination rates are getting better. I actually, I sort of threw it out the window, but I actually think that we actually have an opportunity now. I think that now that the traveling public, the vacations are over, people are back in school. I think people are settling in for the fall and winter. I actually think we actually have an opportunity to achieve herd immunity with the vaccination numbers going up. And I think given the Delta variant, particularly in some parts of this country where vaccine rates have not been as good as we had hoped, I think you're starting to see improved vaccination numbers.
And then Christian, for our viewers, what do you consider to be the herd immunity number that we need to get to reach herd immunity? What percentage?
If for Malden, I would say it's going to be, at least 85, 83 to 85. It's never perfect because, of course, we're going to have people coming and going and we're adding and subtracting. So I would never say 90 or 100, but I'd like to say 80% is a national number that they toss around a little bit. But I think for us locally, considering the diversity of our community and the travel that people have and our proximity to the airport and mass transit, I'd have to say that, yeah. Football season is upon us, which is another thing. So I would take 80% and think that we were in really good shape at that point.
Okay. All right, back to Mr. Cochran.
Sure thing. So we're going to head over to the YouTube channel, and Shailene asks, first of all, she says, hi, and thank you for the update. Could you please talk about how many cases were in the schools for children under 12? Assuming she means Malden public schools, or perhaps, I guess, all schools in the city of Malden for students under 12.
Well, let's start with Chris and Scune. What are you seeing and hearing on that?
I haven't got any hard numbers on it yet. They're still putting together their reporting schedule. I know the superintendent's being notified every day. We're just right now, they have not reached out to us for any assistance with contact tracing or anything like that. So that's a good sign. That's when we've trained the nurses over the last 18 months, and they've been exceptional at taking the training asking questions, and then implementing the training, because these are the same people that vaccinated everybody else in the city. So they know what the game is all about.
Okay.
They have not had yet to pull the pressure valve to call us. So that's a good sign. I know that there have been some, almost a full class has been put out, and that's understandable. It's bound to happen. We know it's going to happen. We just have to get more people who are age eligible to vaccinate. Otherwise, we're just going to repeat ourselves.
Yep, and I'm gonna go to Christian on what he's seeing statewide regarding our youngest learners, and then I'm gonna change it up a little bit for Scune. I want to ask her a policy question. So, Christian, Chris talked locally about what he's hearing and seeing, which mirrors what I'm seeing. I meet with the superintendent every Wednesday, and I think at last count, it was maybe a half dozen cases we've had in the first week and a half, which I think is well within the the percentage that, well, we want 0, but it's well within the percentage we believe is safe. What do you see in the network, Greater Boston, statewide?
So I can't tell you what the numbers are. What I can tell you is that at least this has come up. This came up on Monday with our critical care docs from all of the hospitals in the Boston and metropolitan area. We are not seeing large numbers of children being treated for COVID. So if they are getting COVID, they are isolating at home. Obviously, we still encourage anyone who has difficulty breathing, temperatures that cannot be maintained, to either seek out emergency care or contact a pediatrician. But we are not seeing a large volume of children who are seeking medical care within the health system in this area yet.
Very good. Scune, so Shalene, she's very passionate about the Malden Public Schools and the community, which is great. So her and I have gone back and forth about the idea of requiring vaccinations in the school district. And I think we talked about it beyond. And I think, internally, we just haven't got there yet. And I think one of the reasons is we're hoping that the state will, at some point, level the playing field, because again, us versus another community, I just don't think that is how we want to get to where we want to go. What's your thoughts on that? What are you hearing and seeing in other cities and towns?
I think for the requiring it is, I am hoping that the state will definitely make a decision on that piece, but at least testing those that are not vaccinated, I think. Not requiring it, but knowing what the vaccine status of the people that are providing the care to, especially your children that are not even eligible for vaccine yet, is not something unusual to not ask. It's like, okay, so what's the percentage of teachers and frontline folks that are vaccinated? And then if they're not, requiring some testing so that way we know where they stand. I think that is where what I think should be adopted until we come up with like a policy.
All right, very good. And before we go back to Ron, Chris, why don't we let Shalene and the others that are watching know the good news, I think, right, on where we are with our 12 to 15-year-old population and 16 to 19, I think is how you broke it down. What's their vaccination percentage? I think you had it at 60%, right? Mute, Chris, I think.
I'm sorry. I'm going from memory because I don't have it up in front of me, but it was 64.5 for 15 to 19 and 60% for 12 to 15, and very impressive numbers, but it doesn't speak to the whole community. So we do have school clinics coming up starting on September 21st. Cambridge Healthcare Alliance is our partner on that endeavor. We're going to let them enjoy the presence of the school kids because we did it the first time around, and it's a challenge, but it's just different. than
So
dealing with
Chris, why don't we pull the?
the kids
why don't we
do
pull the
better.
flyer? Yeah, let's pull the flyer up and you can talk about it as it's on
Sure.
screen.
Here we are. As you can see, it's in multiple languages, so it will be being mailed out to everybody's home starting this week. I think they probably hit the mailboxes no later than Thursday. So it's on its way to you, so you have it. As you can see, September 21st, we start. They'll go from Malden High to BB to Forestdale to Fairway to the Salemwood and then to Linden for no other reason than that's just seemed like a good way to go. And we'll be doing it every day in those dates listed from 11 to 2. We would ask people to please use that QR code and use that to interface with the registration system. You can come in with a form. And if you forget your form, we will have people with phones so we can call parents and make sure that's what they want for their kids. And we'll make sure that they get vaccinated that day so that we don't drag this out any longer than it has to be. We're not taking more time away from their learning.
And Chris, this is not a walk-in clinic. This is just for the students of the school.
It
and
is.
their families, right? And their
Students and staff, yeah, and their families, we will vaccinate their families if they're, as long, we don't want the public coming into active school. It's, those who are invited, which is those people who, family that attend that school are welcome.
Okay. And Christian, one question we've been getting, when will the vaccine be available for 0 to 12?
So I think that all eyes this week are on the FDA, and if they are actually going to make those groups part of the discussion this week. I'm not entirely confident that this is going to be open to children from newborn to 2 years of age. Most vaccines are predominantly 2 and above, while there are some childhood vaccines that do go down to newborns. I think in this case, I think there's more work to be done, but there seems to be some indication that this is on the agenda this week with the FDA. And then, obviously it'll move over to the ACIP and then to CDC and then likely roll out. So I think there's a lot of anticipation about what the science is showing and what groups will likely be the targeted for additional boosters.
So Christian, for people watching, what month would you guess that it might be here in our community being administered?
Depending on how fast they move, I mean, they are meeting, I believe it's Friday or Saturday this week. And I believe that they are trying to move as fast as they can. While we recognize that the president had made an announcement that they wanted them out by September 20th, the FDA is probably most likely not going to make that date. But I do think that the way these vaccines have moved in the past, they have gone through the various independent bodies fairly quickly, and they were rolled out. The great news is, I think that, as we all continue to wait for these discussions to be had, the CDC is reporting that there is sufficient vaccine available for anyone who is looking for that third dose. But also anyone who is still thinking about getting that first dose, this is a great opportunity to get it now.
All right, very good. Back to you, Ron.
Sure thing. So before we move on, again, we just want to remind folks that you can ask your questions over on Facebook. You can message us your question there. You can ask those questions in line as Shailene did in the feed from YouTube, UMA's YouTube channel. And of course, you can always call in live at 781-388-9394. And I was reminded by our super duper producer, Terlonzo Amos, who said that we are now on our 31st show, which is quite impressive. Sort of bittersweet, right? Because if we're still doing it, it means we're still in a little bit of trouble, but at the same time, incredibly positive. We always hear great feedback about these shows. And we really, I'll echo what Mayor Christenson said earlier. We really appreciate our partnership with UMA to help present this information to the public. So let's head back to the questions. variants. We've been hearing, Delta is obviously something that you've heard 1,000 times, but we've got new ones that are creeping up. And I think the two-parter, and I'll summarize like several questions that were asked about it, but basically, should we be as concerned about these new variants? And are we at the point yet where some variants might not be covered by existing vaccines?
Who's the two, Ron?
Let's start with Christian on this one.
So here's what I would say about the variants. I think that, for anyone who has studied science, variants, there's always going to be variants with viruses. This is how viruses have been around since, the world began, and they will continue to way outlive all of us. I think the important thing is that, the Delta strain has shown itself to be quite aggressive, but there's a new strain of Mu that's out there now. It's listed in 26 states. What we don't want to do is we don't want to get ourselves into a situation where more and more variants are taking targets at these vaccines. While these vaccines are holding up quite well, we don't want to get ourselves into a situation where perhaps we're getting variants that are becoming more powerful than what the vaccines are protecting. And so we don't want to be in a situation where, we are, our defenses are being overtaken. So the most important thing to prevent this is for people to get vaccinated. Keep these numbers up, build the immunity, and we can try to keep this at bay. But it's going to take all of us. All of us have an opportunity and obligation to help defeat this. And we can do this, but it is going to require everyone taking steps. I would say, masking, protecting your neighbor, and getting vaccinated to keep these variants at bay.
All
I
right,
don't
Scune,
think
I
there's
see
any
you.
other way to combat this.
Yep, Scune, I see you nodding. Agreed, right?
Yes, I think with the way that Christian was framing it, I'm like, we seem to be going down the alphabet with the Greek alphabet with with these variants. And like Christian explains, like that's just how viruses work. And we know that being vaccinated decreases the rate of infection. And so we just need to all do our part and get vaccinated, and then the socially distancing and the masking just as part of an overall strategy to really just address all of these extra Greek alphabet letters of variants going down the pipeline.
Yeah, so Chris, let's tell people how they can help us do that, right? So by more people being vaccinated, the less opportunity, right, for variants to develop. Is that it?
Yeah, the best way to get rid of a virus is to eliminate a host, right? And that's basically how it works. We're just a host. The virus is the apex animal in the germ world, and we now are at its mercy. So the best way to do that is take advantage of the vaccine, masking, hand washing, distancing. Okay, that's not going to change until someone somewhere says it's over. Now the Mu is is one that came on relatively quickly, but I think it's probably going to build to a Delta-like level. It's not quite there yet, but I think it will. And the only reason I say that is I don't think it's had enough time in some of the unvaccinated states to spread. I'm sure it's there in higher numbers than they're reporting, because trying to figure out if it's Delta or Mu isn't a focus point right now. The people that need to know whether it is or it isn't. And as soon as it gets to a level that we need to know about it and that we have to take additional steps, we'll be informed. That's what CDC is good at. That's one of the things they're good at. So I would keep our faith in the science. We had the Delta we know today is Delta 2.5 probably, right? We don't know. Mu, before we, we'll go through another bunch of subdivisions before it becomes a virus of concern, as they like to say. It's, I think, just knowing the number of people that aren't vaccinated in the southern and middle part of this country, and the travel that we're coming into. Keep in mind, travel season is upon us. that mu could mutate very quickly and become a bigger issue. Now, do I think it will outdistance our vaccine? No, I do not. I do not believe that for a minute. I don't think it's had enough time as a virus. It's not as a complex virus. It's a virulent virus, but I don't know that it has enough time yet to become more infectious than Delta. But if people don't get vaccinated in these low vaccination states, or even stay unvaccinated themselves, they're going to come in contact with it and they will get sick. What the consequences are, it's too early to tell.
Okay. So Christian, someone watching this show says, all right, I'm convinced I'm going to get vaccinated. Question is, how long will the vaccine last? What is the latest study or data showing you?
Well, I think what we can tell, we can safely tell people is that the clinical data that they have been, that they have been monitoring, and this has been the greatest, most amazing number of people that you could ever bring into a cohort study. What they're demonstrating is that the vaccines are holding up very, very well. I think people need to be reassured that the vaccines are holding up quite well. I think that there is some debate within the science community based on, the level of effectiveness. At what rate does it start to drop? Is it 6 months, 8 months? I think that we'll probably see more of this as the CDC and the FDA starts to unmask the data, and we will probably have a better idea of where this looks. However, I think it's still showing very clearly that these vaccines are not only holding up well, but as the healthcare workers were, they were the first groups of people to be vaccinated. Not only is it holding up well, but these vaccines are still keeping people out of critical care. And that is something that is, while we want to keep them out of the hospital entirely, we are keeping, our ICUs are nowhere near capacity like they were based on the spring, and certainly during the spring of 2020.
All right, very good. Back to you, Ron.
Sure. Just one comment before we go on is that, given that I've been able to participate in these shows since day one, I sort of had a flashback of when we were in the midst of the beginning stages of this pandemic and the helplessness that we had about just not really knowing how we would be able to get on with this. And now, as we're dissecting between mu and Delta, I mean, these are sort of luxuries that we have, right? That, we have a way to prevent this. We have a vaccine in our hands. It's just what a sense of relief that we have an action before it was so helpless. So just a comment as I see, as I sit here in the 31st show, as pointed out by Terlanzo. Back to our questions here. So the question is with regard to protection from the Johnson & Johnson vaccine. There's been so it seems to go up and down. I've seen different numbers. I've seen 70%, I've seen 95%, and it's been all over the place. And then maybe if that could be coupled with the response on what the outlook is for a J&J booster. So I guess why don't we start with Chris on this one?
Well, J&J is the vaccine of choice that I gave my wife. That's what I recommended for her. She's disabled and has multiple issues. She is not in the 35 to 50 age range. She's older than that. I won't say how much older, but we all know why. Thank you. So, but she's convinced that it was, she had no issues with it at all. It actually went very well for her. I think it's going to have a booster shot. J&J, if they have a booster shot, will come to the party much later than the Pfizer and Moderna. And for the main reason being that Pfizer and Moderna have that many more people who have been vaccinated with it. So Johnson & Johnson did make a statement, and I don't know how accurate it was, but they were convinced that if you got a booster, you would get 9 times the effective rate. I don't think anybody needs 9 times the effective rate for anything. So it may be that Johnson & Johnson doesn't need a booster. But again, back to the other question we had, how long are these vaccines good for? The answer still is we don't know. We are walking laboratories, and we will be giving that data back as people are tested for their antibodies. And I feel that I think their goal was to make it a year, and I think they probably pulled it off. I'm hopeful. This winter will tell us more. Does it, is it going to be because we're inside that people are transmitting more? I don't know. Is it going to be the vaccine getting less effective? I don't think so. But we would, if FDA approves it, we will have boosters to counter that. So, but Johnson & Johnson is a good vaccine. I wish it could have been used more. It just had too many negative press going against it. There's so many people that could have been helped by it being one shot, take less time, less energy, more of it available. So the boat was missed by a lot of people with the Johnson & Johnson.
All right, let me jump up to Scune. So we've been focusing on the unvaccinated and the impact that they can have on where we're trying to go. But what if someone does get the vaccine? Can they spread COVID? Can they be a spreader? What is your understanding of that?
My understanding is that with the variants, I think we just talked about the variants and breakthrough infections and all of that. I think it's definitely possible because viruses evolve. And I think at the end of the day with the transmission, it's just much lower if you are vaccinated.
Okay, Christian, here's one for you. I've never seen this question before. What is an aerosolized spread? What's the difference between aerosols and droplets?
So aerosolization is essentially is a practice that you will most often see in a hospital setting, where when we do, we put a tube down your throat to help you breathe, right? There's aerosolized droplets that are being spread when people are in, when we're doing asthma treatments, as it's coming out, we are aerosolizing. So think of it as a spray, how you're able to aerosolize the room, whereas droplets are droplets of spit when people talk. But what aerosolization does is it's a misty and it's moving about the room much, much more. And so when you're in a healthcare setting, we put those kinds of patients in what we call a negative pressure room. Now it's your own room, but what it is it's the only thing that's real fancy about it is that the air exchanges from the ventilation system are much more common. And so we're able to move those droplets out of the room much faster. And what that does is it allows for everyone's safety. It allows for the healthcare workers' safety, the patient or their family members' safety when these procedures are being done. I think as Ron was talking back, just how far we've come. We have come a long way, and we've learned a lot, not only about COVID, but just infectious diseases overall, especially in the spread of. But so if you have COVID, I highly recommend if you have asthma, you do require a neb treatment of some sort. My recommendation is to reach out to your primary care doctor for advice on how to do this. We want to limit this as much as possible.
So Christian, is it safe to say that most people who would contract COVID are getting it via droplets?
Well, droplets is the most common, right? That's the most common way people are getting it, which is why we're asking people to, the 6 feet rule. The 6 feet rule is really designed to limit the amount of droplets that you might inhale from someone else. And that's why the mask is so vital. And that's why the mask works so well. Me wearing the mask is actually it's protecting you. By you wearing a mask, you're protecting me. And that's why the mask program works. It is not designed to suffocate people. It is a simple protection measure to keep your neighbor safe and keep yourself safe.
Okay, before I go back to Ron, Chris, I thought on one of the calls I was on, the state told us that you need 15 minutes of continuous droplets or being in the vicinity of someone that has it to contract it? Is it one, but, you know, based on what Christian's saying, could it just be a couple minutes of droplets and you're it?
You know, I think a lot of this comes down to perfect. These are perfect measures. And I think that we live in a world of imperfect, environments.
Okay. And Chris, you agree, it looks like.
Absolutely, yeah. I mean, the 15-minute rule is like, I say this a lot in my line of work. Public health works to the minimum standard, right? So that is the minimum amount of time that you should be, should consider being in someone's company unmasked, because anything longer than that, we know that exposure is going to bring you higher into a category of infection. 15, and it has a lot to do with how people behave in those 15 minutes of interaction. Typically, people start a distance apart, and then when they start talking, and especially if they are agreeing or seeking knowledge, they get closer when they're speaking. So, that doesn't always work in a school setting, but the teacher's trying to get a point, they move closer. The kids want to hear it, they all lean in. Those are things that you really want to look out for. So that's the minimum standard. That's all. That's why it's 15 minutes.
All right, very good. So we have about 15 minutes left in the show. Ron, one more time, how can people participate? And then let's take the next question on your end.
Yeah, sure. You can go on our social media channels, most particularly our Facebook page. You can send us a message there. You can jump over to the Malden Access Television, now UMA, YouTube channel, and ask your question, as Shailene did earlier in that thread. And of course, old school, and that is calling us live in studio. And that's by dialing 781-388-9394. And I'm actually a little saddened that we don't have some of our regulars that we had way back in the day. We used to have a regular slew of callers. We really encourage you folks that haven't called in a while. I'd love to hear back from you. But until that point, we'll continue to take our questions as we have throughout this evening's show. An old one, but a good one. The two-parter, outdoor transmission and surfaces. So this is something that I think in the very beginning part of the pandemic was not well understood. But I think we're at a point now where we do, but it's still a question that we frequently get. So again, what's the risk of outdoor transmission, masked or unmasked? And then what about surfaces? Let's go to, why don't we go to Scune? We'll go to you first. What's your take on this? And then we'll rotate down.
My take, at least for the outdoor one, because again, we're talking about the air and aerosolize and our understanding of the virus. When you are outdoors and socially distanced, the transmission rate is definitely much lower. And then I'll defer to everybody else about the surface piece of it, because that's not something that I know immediately in terms of the updates.
Let's go to Chris.
Okay. Surface, I'll touch the surfaces. Surfaces in the beginning, remember, were a huge deal. I think we used to all show up at the studio in the very first 1 or 2 shows. We'd be wearing gloves, and so we were very concerned. We still should. The aerosol question was a great question, because it brings us back to the basis of it. The being outdoors lowers the risk of transmission, but it has a few variables involved. The distance between the two people, the volume of conversation, whether it be, they're talking, whispering, or screaming. It's not the same as being at the Patriots game or with your buddies and your family. That's not the same as being at Mystic Station with the same family sitting at the table. 2 different animals. I know a lot of people try and say, well, if I can do that, I can do that. No, it's not true. Your distances change, your volume's changing, your output is different, and that's why eating outdoors is probably still the best way to, safely enjoy a meal right now. I recommend it to everybody. I know that it's kind of that I've seen in the community is we have a very good rapport with the restaurants, and they're kind of doing a little bit of inside out. Some folks are put outside whether they want to or not, because there might just be a little too crowded, and too crowded today looks empty to compared to what it used to be, you know? So we've had a lot of good support from our restaurants, and supermarkets have been great. So I would say to folks, yes, I know everybody loves the outdoors now because it's the safe place to be, but keep your distance, you know, don't shout to one another if you don't have to. Get a little closer if you need to communicate. Singing is not another, in a group is another known problem, especially indoors. We like to see them practice outdoors at 6-foot intervals, changes the sound of things, but it is good, you know, still safe practice. So that's what I would recommend as far as indoor outdoor goes.
All right, Christian, the same?
Yeah, well, I would say, you know, there's a difference between porous and non-porous surfaces. I think at the beginning of this, especially when we were looking at fomites, I think that we just didn't have a lot of information. I'm gonna go along with Chris. I don't think it is as much of a concern as we've learned a lot more about this on surfaces. I still think it is better and safer to be outside than inside. But I agree with Chris, regardless of if you're outside, you still need to practice social distancing measures and good hand hygiene and mask wearing.
Okay, Christian, let me stay with you and then we'll go back to Ron. So one person asked, I did Moderna. They figure out the booster. Can it be a different vaccine? Or do you have to go Moderna?
So the recommendation is right now, the recommendations are being made is that we are advising people to stay with the original manufacturer that they received. However, there is an opportunity for people to get something different. Let's just say, for an example, you are at a clinic, you did get Pfizer, but they only have Moderna. It is safe to get Moderna. So I think that these have been looked at pretty aggressively. What you cannot do, though, is that you cannot have Johnson & Johnson and then ask for a Moderna or a Pfizer mRNA vaccine. They are different. So for now, the third booster shot is basically being focused on Pfizer at the moment. It's not even Moderna. It is focused on Pfizer only this week. So I think, you know, the Moderna has put in their application, and Johnson & Johnson has signaled that they also are putting in information. But one thing I would like to leave everybody with is that the vaccines are so heavily studied and so heavily regulated to make them safe, because these are all prevention strategies. But what's important is that the FDA makes their initial recommendations. It goes to the ACA, the Advisory Committee for Immunization Practices. They are an independent group of public health and medical experts who are not government officials, who come to the table and provide their expertise. So these are people just like you and me who are actually advising the CDC and the FDA on safety practices with vaccines, which is they get it before the CDC will certify it. So I will say that through the entire immunization safety programs, I think we should all be very fortunate that the ACIP does exist. And their recommendation this week is going to be based on Pfizer and Pfizer alone.
All right, very good. So we have just a few minutes, Ron. Are there any last minute questions before we do closing?
No, I think we've covered all of our channels here. So hearing none, seeing none, I think we can defer to our closing remarks here.
All right, Scune, why don't you lead us off?
Sure. So thank you for tuning in, everyone. And for the 70% of you that have gotten vaccinated, thank you for protecting yourselves, your family, and our community. And for those of you, if you continue to have questions about the vaccine, just ask your primary care doctor and look at some safe and reputable and ways for you to just get the information that you need, and really want to encourage you to get vaccinated. And thank you for tuning in, and I look forward to the next one.
All right, very good. Christian?
You know, I just want to say, I appreciate being invited to this. I think this is a fantastic panel. I am so appreciative to all the residents of Malden. I would say that we care about each and every one of you, but to the 30% of the residents who are either hesitant, I would implore you to reach out to an expert who can provide you with sufficient feedback on the safety of these vaccines and get your questions answered so that you too can become part of the community where we can all participate and enjoy our lives just as we have before COVID began. And I want to thank all of you, and thank you, Mr. Mayor.
Okay, and Mr. Webb.
As usual, you know how I feel about these shows. I love it. I really want to impress more people, and parents in particular. We do have the vaccine clinics coming up. We brought in CHA with their expertise so that parents have even less to worry about on site. I think between the support we're going to offer CHA and what CHA is known for, we can make this a pretty safe experience for your kids. We look forward to that challenge, and we're more than up to it. Definitely more than up to it. The kids that have already been vaccinated will tell you it's not a big deal. You're in, you're out, and we try to make it as pleasurable for the kids as we do the adults. I want to remind people, look in your mail this week and early next, you'll have the schedule in your mailbox for the schools. So take advantage of it, please. If you have any questions, please call our office at 781-397-7049. And any adult who can't get to school at the first, September 21, and thereafter on October 3rd at the Public Safety Day at Linden School, which is a great take. Everybody should come, even if you don't want to get vaccinated, but we will be there. We'll be able to vaccinate anybody who wants to come. Hopefully a lot of people change their minds. I'd love to see a line. We'll try and make it worth your while you're there. There's so much to see. The kids have a great time. The adults also have a great time. It is a great take. And as you can see, that's the exact mailing that you will receive this week. Please take advantage of the QR code to make your registration a little easier. But like I said before, walk-ins are welcome. Kids forget their slips. We'll be calling mom and dad, get their permission to make sure that we get them done. There will be no excuses, no excuses. As my Mrs. I forget her name. My Leonard school teacher used to say to me, there are no excuses. So I want to thank everybody for the work that you've done in the community. I want to thank our community partners again, the Greater Malden Asian American Community Group. They've done a ton of work. The Everett Haitian American Community Group, they've also done a yeoman's work. Incredible outreach. We've had some outreach people in the neighborhoods. I know it's kind of, everybody's seen them. They've provided us with substantial information that helps us make decisions that better protect you every day. So I want to thank everybody for being tolerant of one another. I expected to have 100 stories about how people behaved. I have none. I just can't say how proud I am of the whole process, and I appreciate the community's cooperation.
All right, very good. So thank you all for tuning in. I want to thank Ron Cochran, Urban Media Arts, and to the unvaccinated, on behalf of Scune, Chris, and Christian, we need you. So please help us continue to get to where we all want to go. We'll see you again soon. In the meantime, stay safe. Good evening, Malden.
Recording stop.